Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na, So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then, secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulite siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya, na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, hindi naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo, kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Ay, Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Hi everyone, I'm Sheila and welcome to another enlightening episode of Simply Healed webinar. This program is proudly brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Simply Nature is an international distributor of food supplements made from a unique strain of microalgae called PPARS. And backed by scientific research, PPARS have known remarkable benefits in supporting cancer treatment, enhancing general health, and helping to reverse metabolic conditions such as hypertension, diabetes, and high cholesterol and cancer. To quickly recap last week's webinar, we tackled a powerful topic called the need to complete the treatment, the journey from biopsy to remission. We learned that the journey from biopsy to remission requires courage and consistency in completing treatment and giving the best chance to eliminate cancer cells and prevent relapse. We were encouraged that remission is possible when we stay faithful to the process, and there is real hope beyond the struggle. It was a very informative session with plenty of great questions well addressed by our experts. Now, this week, we turn our focus to a deeply important theme because tonight's topic is entitled The Role of Sugar in Cancer, Understanding Inflammation Causes. Let me start with a simple question. How many of us enjoy something sweet after a meal? Perhaps a slice of cake, a can of soda, or milk tea. Sugar gives us the instant boost of energy, but what if I tell you that sugar is not only feeding you, it might also be feeding you with disease inside your body? Tonight, we are diving into the role of sugar in cancer, understanding inflammation causes studies. And these studies show cancer cells have big appetite for sugar. They thrive on it. And when sugar levels are constantly high, it doesn't just cause weight gain or diabetes. It triggers chronic inflammation, creating the perfect environment for illnesses like hypertension, heart disease, and even cancer to grow silently over time. But here's the encouraging part. This doesn't have to be your story. By making smarter lifestyle choices and supporting our bodies with the right nutrition, we can calm inflammation and strengthen our immune system. It means we are not powerless against sugar effects. We can fight back. This is where science meets natural healing. Because for more than 20 years, Simply Nature's microalgae-based supplements called PPARS have supported patients across Asia. Clinical studies show that PPARS help regulate genes, switching on the good ones and switching off the harmful ones. They boost dendritic cell activity to identify abnormal cells and enhance natural killer cells to destroy them. This makes PPARS an effective support for those facing cancer, diabetes, and chronic inflammation. Patients often share how they regain energy, appetite, and sense of normal life again. Now, the intention of today's webinar is to make sure we answer more questions coming from all of you for us to be able to empower you even more in your journeys. So without further ado, let's dive right in. Leading tonight's AMA or Ask Me Anything portion is our highly respected health experts. First, it's an honor to introduce Dr. Jansen a graduate of St. Luke's College of Medicine and a diplomate of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. He will be joined by another expert who is a very successful entrepreneur, seasoned international speaker who brings deep insights into personal health and success. He is the CEO and founding director of Simply Nature International and our PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan. Good evening, Dr. Jansen.
Good evening.
Hello. Good evening.
Excellent. It's nice to see you both tonight.
Yeah, nice to see you too.
Nice. Yeah, nice to see you both. Doc, actually, I wanted to ask you a question before we begin. Is there how bad is inflammation as a issue in our society today? Do most of us have inflammation? And how would you know if you are suffering from chronic inflammation? if you don't have any like illnesses? Are there some symptoms that will indicate that, you know, the category where most people belong in, we're not sick, but we're not healthy. And that's the category.
Yeah, yeah. Well, nowadays, but I can't really give you a ballpark figure, no, because I would be biased because I tend to see patients who are quite sick. Okay. Yeah, and healthy enough patients don't actually come to me to talk to me about their health, no, because yeah, I am into integrative oncology. So, but uh, if you think about how we live nowadays, it's really quite easy to have, abnormal inflammatory markers. It's quite easy. It's quite easy. So just with food, no, it's really very easy to get unhealthy foods. If you're sedentary, if you don't sleep, 7 hours, 7 to 8 hours every single night, plus if you do have vices, then it's, inflammatory markers are gonna go up. Would there be signs that you have, low chronic low grade inflammation experiencing, but if a ordinary doctor or regular doctor, your GP look at you, he would classify you as someone who's not sick. Yes, there are a lot. I mean, lack of sleep. If you have difficulty sleeping, that would be a sign. If you have fatigue, no? You're easily fatigued, then that would be another.
So if you get tired
yeah.
easily.
Yeah, that's right. That's right. Some patients, they do develop skin manifestations, symptoms, no, that comes out of the skin. One example would be acne. If you are someone who's, I mean, you're not sick, but you have, skin problems. I mean, you have acne breakouts. Then you have chronic low-grade inflammation. The root cause would have to be identified, no? Yeah, these things. No? So definitely there are signs, subtle signs that you have chronic low-grade inflammation. Yeah, but the doctor would have to be able to discern this.
So doc, things like if you get cough easily, if you eat a bit of how shall we say, yeah, if you get cough easily, if you get the flu easily, or sometimes you wake up with a bit of pain in your joints, these are all signs that you could probably be very chronically inflamed. Doc, what about mouth sores? If you when we accidentally bite ourselves, some people 100% they will definitely get a canker sore or mouth sore. So that's also an indication that you are probably suffering from chronic inflammation.
Well, at least in Western medicine, no.
Okay.
Canker sores, if you bite your lip, sometimes you do get one depending on how hard you bit yourself. I mean, if it's really that bad, right? I mean, yeah, you're gonna develop canker sores. But at least for Western medicine, in med school, we weren't taught that inflammation is high. You do develop easily, canker sores. Well, if you have certain viral infections, I mean, you can get this. One example would be herpes.
Okay, that's true. That's true. All right. Okay, thank you very much, Doc. So for everyone, I think it's safe to say that most of us are probably suffering from some form of low-grade inflammation. Maybe not daily, but quite often due to our lifestyle and the food that we eat. Because I think most people do suffer from chronic fatigue. And it might not be, can I say this, Doc? Chronic fatigue might not be a cause of indication that you're inflamed. It could it also be a cause for you to be inflamed? That means you're working very hard and working very late.
Yes.
Will that cause inflammation? Okay, so working hard and working late actually causes inflammation.
Yes, because of inadequate rest.
Wow.
Yeah,
so
you're working too hard.
So stress actually causes inflammation, ladies and gentlemen. So, one of the main facilitators of cancer and what makes cancer thrive is actually chronic inflammation in our body. So having stress and inadequate rest actually creates a breeding ground for cancer and definitely makes it easier for cancer to develop. All right. Yeah. So Sheila, let's jump into our questions tonight.
Right. So for our first question tonight, coming from Ms. Fe Tolentino, Does it also, are PPARS, is it also good for patients with DCIS done with mastectomy? And how about when taking hormonal medicine like tamoxifen? And she wants to start with Simply Nature. Do I have to stop the hormonal medicine?
You can take them together. You can take them together, so it's okay. Uh, yeah, it's okay. It's okay. But here's the thing, though. The application of PPARS in your case is not for the cancer already. It would be the underlying metabolic issues that you have. Okay, so that's the application. So yeah, definitely you can take them together, but not at the same time. Okay, so separate them. All right.
So I like what I like what Dr. Jansen said, because many times we take PPARS, or we go for integrative medicine for one for the main disease we want to treat, but many of the integrative protocols will also have additional benefits, and sometimes they will prioritize some other aspects of your health to be the main target, and then actually supporting or fighting cancer becomes secondary. So it's like you can actually address some of the root, how shall we say, the important factors that cause cancer to thrive. And when you get that under control, it actually directly impacts your efforts in fighting cancer. Yeah, so I like what Dr. Jansen said. It's very interesting. It's also very enlightening, that sometimes when you want to treat one disease, it's important to focus on another first. Doc, this is especially true in Chinese medicine, because before they try to treat your illness, they tend to always nourish the two main organs, the liver and the kidney. They always nourish these two first before they can go and treat your illness. So yeah, very insightful. Thank you, Doc.
We're starting off really, really good. Thank you, Dr. Jansen and Sir Shyan. For our next question coming from Ms. Cecilia Arellano. Can PPARS help hypothyroid with nodules?
Whoa, Doc,
Yeah,
good
definitely.
experience in
It
this.
can. Yeah, it can. It can. Especially with the nodules. But again, if you're taking medications, do not replace your medication with PPARS. It has to be taken at the same time. Okay. So
have a
yeah.
consult with Dr. Jansen for this particular patient. For all hyperthyroid patients, the short answer is good news. We are able to help you. All right, we're able to help you. The important thing to take note is, and personally is my opinion as well, that for any hyperthyroid patients, I really prefer for them to be monitored by a medical doctor. So Dr. Jansen, and having a consult with Dr. Jansen would really be the ideal choice. But here's the good news. Yes, it's going to help you, and Dr. Jansen actually had fantastic results and experience with hyperthyroid patients. Okay, why I say that? Because hyperthyroid patients can have a lot of reactions. They can have high fever and all that. So, and most of us have to go to work, right? So it's something where I do not want patients and clients to subject themselves, and they might be worried, how come I'm running a high fever when I'm taking this and that? So as Dr. Jansen says, you have to manage adjusting your medication at the same time as when you go on a protocol. But the answer is yes, you're gonna have it's very hopeful. So have a consult with Dr. Jansen. Sheila?
Definitely. All right. I just want to ask, this goes for both hyperthyroid and hypothyroid, correct?
Yep.
Yeah, correct. That's right. That's right.
Right. So anybody with thyroid issues, good news. All right, there's hope. So have a consult with Dr. Jansen. He's gonna help you.
Yes, for those of you who wish to have a consult with Dr. Jansen, simply type in how to consult. Our caring HCS, Ms. Beth and Ms. Irish, will definitely get in touch with you individually. Right, for our next question actually, the first one that I'll be reading is a comment and then a question coming from Ms. Noemi Veras. Okay, good evening po. Breast cancer stage 4 since 2022. HER2 positive and PR negative. Finish all chemo plus 36 targeted trastuzumab. Consume 25 PPARS powder and 3 boxes of liquid PPARS. Data CT scan with contrast whole abdomen and lungs cleared. Amen.
Wow,
Congratulations.
well done. Congratulations.
Thank you for sharing. Now, as of now, I'm still on chemo orally with capibin and lapatinib. What would you recommend as PPARS as of now? Thank you po.
Oh, go, Doc.
Uh, so- okay. For capecitabine and lapatinib, since you're going to be every day on this, especially for capecitabine, my suggestion would be uh, to take the PPARs during your week of rest. Okay, during your week of rest, then that's the perfect time to take it. So the purpose is and to make your recovery faster in between the cycles. So that's the purpose. Okay. Yeah, so that's how I'm going to do it. But the type of PPARs that would be applicable for you, I have to talk to you. Okay, I have to talk to you. But because the general recommendation would be liquid automatic. Okay.
Thank
So,
you. Yes, sir.
so I just want to share with this particular patient. So, number one, congratulations that all your results are clear. And I just want to share with you that as you consult Dr. Jansen, let him know about financial strength as well. Okay? We always recommend the best protocol for you. All right, the best protocol for you, which is always liquid. However, as you mentioned, 25 jars of powder already and 3 boxes of liquid. So I'm sure you're feeling strong. So we just want to finish the entire journey completely and strong and well. So have a good consult with Dr. Jansen. We look forward to hearing your testimony. All right. So yeah, Sheila, we should get in touch with this particular viewer.
Yeah, I was about to say that we have a lot of patients who are helping us out in and sometimes answering some questions of their fellow patients on our comment sections. And Miss Noemi is one of them. So thank you. I can really say that we are having a very good and kind-hearted patients in our community. So Miss Noemi is one of them. Thank you. Thank you once again for sharing. Okay, for our next question coming from Miss Lenny. Are the products good only for cancer patients? Are the products safe to use for people with anxiety disorder and hypertensive and diabetic?
Yeah, it's good for them. It's good. Yeah, these are metabolic issues, so definitely it can be used for this. For anxiety disorder, I can't comment about it because it's not my area of practice.
All right. Thank you. Sir Sean, would you like to add anything?
No, I'm all good. Can you repeat the question again? Sorry, I was just slightly distracted. Yeah.
Sure. One more time. Are the products good only for cancer, or are the products safe to use for people with anxiety disorder, hypertensive, and diabetes?
Oh, definitely. Our products are really good for diabetes, many root causes of hypertension, because hypertension has lots and lots of possible causes. Yeah, in fact, when our products began, when I started with the product more than 20 years ago, our main target was for diabetes and blood cholesterol. All right, so definitely how fast, actually, Dr. Johnson is also quite an expert in this area, using this for metabolic syndromes. Before he started to focus on integrative oncology. Yeah, so yes, for the metabolic syndromes, what product would you need? If you are mild diabetes, the tablets is fine. The recommended dosage will be at least 10 micro tablets, at least twice a day, preferably 3 times a day. So that will be 30 micro tablets a day, and that'll be good. If your diabetes blood sugar is moderate level, then I would suggest soft gel capsules, because those one soft gel capsule is equivalent to about 20 to 30 micro tablets. So it's easier to just take one soft gel capsule. So the good news is, at the same time, it's going to actually help with your hypertension, your diabetes, and possibly your anxiety, all at the same time. All right. So that's the good news. You don't have to be taking many different types of supplements and drugs at the same time. So for the anxiety one, I just want to share, very interesting. We had 20 years ago, we actually had a client who was taking the tablets, all right, for the main purpose of diabetes. He then reported that he was off his Prozac. So Prozac is actually antidepressant, right? Later on, I did find out, learning with my experience with doctors and like my many conversations with Dr. Jansen, how important, and also Dr. Maribel Alhambra, she's actually a neurologist, right? How important our gut health is for our mental health, right? The gut is where your serotonin, a very important hormone that is produced. So this part, your gut health is very important. So actually taking Simply Nature PPARS also helps with that. And also neural inflammation is also another aspect of brain disorder. So when you're very stressed and all that, you also create a lot of neural inflammation. So being able to help with inflammation also helps. Okay, again, it's not a direct, we don't use Simply Nature PPARS for anxiety, all right? But specifically, but we have so many cases where our patients and clients are using it for example, metabolic syndromes, and it helps with their anxiety. Now, another good example is autistic children. I have personally 2 friends who have autistic children. One of them, the autistic children, is actually two of his sons, both are autistics. So you can imagine how difficult it is when your autistic sons, both of them are 18 years old and above. When they get into their fits, they can actually beat up the father as he tries to calm them down. All right, so this is a very challenging thing. So one thing that helped is that when the sons were on tablets, they were a lot more calm. They were a lot more calm. And Dr. Alhambra actually used our products, our soft gel capsules specifically, all right, to replace tranquilizers for one of her brain disorder patients with schizophrenia. So instead of giving tranquilizers to calm down the patient, she actually used soft gel, and it helped, and the patient didn't zombie out. So I was very surprised because, like I said in the beginning of my answer, we do not actually specifically use our product for brain disorders and things like anxiety. We don't, it's not what comes to our mind. So definitely I asked Dr. Alhambra, why did you choose to use soft gel capsules? So again, she related to inflammation, and that's how we began. So yes, it will help you with a metabolic syndrome, and it might make you less anxious. But again, the source of anxiety is not, I don't know about Dr. Jansen. Would you say that it's anxiety is largely biological? I think it's a lot more mental, your mental frameworks and managing your thought life to be a primary source of managing anxiety. But at least from the biological functions aspects, I think it will assist. Again, it's not the primary use of PPARS, but since you're taking it for metabolic syndromes, it will also help you with hopefully it will help you with your anxiety. Yeah. Sheila?
Excellent. Thank you, Sir Sean. Very encouraging. Okay, next question. Before we go to our next question, I just of course want to greet our viewers for tonight. From Ms. Helen Kamunayan, we also have Ms. Rain Sebastian, of course, Ms. Noemi Veras. We also have Elena Antonio, Edna Aveo, and just a second. All right, later, I'll be doing a shout out for the others later. Now, for our next question coming from Mr. JB, for bacterial prostatitis recurred after 9 years, prostate size is 38 grams, but normal PSA level and normal uroflowmetry test without urinary complications aside from pelvic pain. Which PPARS is the best for me?
It's not papers that you should be taking. But if you want to use it as an adjunct, it would not be for the bacterial prostatitis. Yeah, so I have to find out what other issues you might have. Okay, it's not for bacterial prostatitis because your issue is a bacterial infection. That's why your prostate is inflamed. So you need an antibiotic.
Yes, definitely. So go for a consult, Dr. Jansen.
Yes. So once again, for those of you who wish to have a consult with Dr. Jansen Kalalan, simply type in how to consult. Miss Beth and Miss Irish will message you right away. Okay, for our next question, okay, are tablets good to resolve side effects of chemotherapy?
Okay, I think the tablets are good to support your general well-being when you're undergoing chemotherapy. To really combat the side effects of chemotherapy, I would say you should at least start with the soft gel capsules, all right? And on the days that you're actually taking your chemotherapy, at least 2 capsules, or one in the morning and one in the evening. And however, for for all our cancer patients that are undergoing chemotherapy, we would actually recommend liquid. Okay, we will definitely recommend liquid. But I do understand. I do understand one thing, okay? Cancer is a expensive disease to fight. So for those who have a lot of budget constraints, which is many people, so if you're one of them, don't feel alone. You are actually, most people will face a lot of financial pressure when they are fighting cancer. Okay, so this is very absolutely normal. Then we will start with the soft gel, because there is a good chance that with the new chemotherapy drugs, your side effects are actually less than in the olden days. So what you can start with soft gel capsules first, and if everything goes well, then just maintain with soft gel capsules. Okay. If your budget is constrained, go with a minimum of 1 soft gel capsule. If you happen to be one of those people who actually don't suffer much side effects from chemotherapy, although you would definitely have still some side effects, then soft gel capsule might be a answer for you. So for many of our oncologists that we talk to, when they ask us for protocol, we do start them with soft gel capsule. However, if you meet integrative oncologist like Dr. Jansen, he will do more. Dr. Jansen will do more than just try to support through your chemotherapy. He will actually do his best and use different protocols to strengthen your body and to increase your rate of success. All right, not just support you through the chemotherapy, but actually help you fight cancer better with different approaches. So I think Dr. Jansen will definitely go for the liquid from my past, for this year's experience with him when he shares. Yeah, but tablets is just general wellness to support the nutritional needs through cancer, but definitely not enough to manage your chemotherapy support. Doc?
What's the question again?
He asked if tablets are enough to manage chemotherapy side effects.
Yes.
Okay. Tablets, is it enough? For some patients, yes. For others, no.
Yeah. So for safety's sake, I would just say start with the soft gels. All right. If everything doing well, then you can consider the tablets. So it's really the middle ground. Yeah. And then if it's not enough, then you upgrade to the powder or liquid. Right.
Yes. Thank you. Thank you, Sir Sean. Thank you, Dr. Jansen. The next question coming from Mr. Ferry. Which PPAR form is the best for a cancer patient on J-tube? Dr. Jansen, is this the same with the pig?
Yeah, similar to that. J-tube is inserted in your kidney so you can pee. So doesn't matter what PPARS you take, as long as you can swallow, then whatever, as long as you can swallow properly, you're not vomiting, then any type of PPARS would be okay. Yeah, because the J-tube is inside your kidneys, connecting the kidneys down toward the urinary bladder. Unless I'm wrong. There's another J-tube in existence that I don't know of. No? But yeah, that's in general, that's what it is. So to answer your question, I have to see you. I have to see you. Yeah, to help you properly. But for everybody's information, a J-tube or a J-stent is a stent that doctors insert, to connect the kidneys down towards the urinary bladder. So we do this if there is an entity obstructing the ureters. So the ureter is the tube that's connecting your kidneys down towards the urinary bladder. Okay, so because if there's something blocking that tube, your kidneys will balloon, and if it balloons, it will be destroyed.
Wow. Yeah. Okay. All right.
Thank you, Doc. So, Sean, would you like to add anything?
No, I'm good.
Okay, all right. So for our next question, coming from Alexis. Okay, for patients undergoing chemotherapy, when should they take the PPARS? Can they take it on the day before their chemotherapy, but and after their chemotherapy session, when can they resume taking PPARS? Say, for example, cisplatin, doxorubicin, paclitaxel, and capecitabine.
Very good question. Very good question. So this is one of the times that I, change my recommendations already. So if you're someone who's, only watch the early videos, no, of our webinars, you would have done it wrong. Okay, so this is the time that I am changing my recommendations, no, with patients, especially patients who are undergoing chemo. So for chemotherapy, if you're on this, it's important that you don't take PPARs together or on the same day that you're receiving the chemotherapy. Okay, because chemotherapy is an oxidative treatment. It's an oxidative treatment, and PPARs are very strong antioxidants. So if you take them on the same day, you can actually diminish the effect of the chemotherapy. I have seen this already. So there was this patient came to see me before, no. She has breast cancer and she was scheduled for chemotherapy prior to surgery. So that was the plan of the onco. So this patient came to me for chemotherapy support. So I recommended, okay, this is what you take. Then disappeared. Haven't heard of her, until after months, no, of the surgery. I think it was years, even. So
That's good news. The first part of years is good news.
yeah. So what happened was, uh, um, the patient was taking the PPARS on the same day of the chemo. Why? Because she heard me recommending that you can take PPARS when you're receiving the chemo. So she misunderstood me during the webinar. Okay? So this is also what we mean, that this is so only for educational purposes and not an advice or a medical advice. Okay? So what happened was, so she was quite happy because she didn't feel any side effects at all. Her peers are actually quite amazed how she was able to tolerate the chemo because she's not feeling any side effects at all. She finished it, strongly. Went for the surgery. Surgery was successfully done. Okay, so she was quite happy that I was quite successful. I did the chemo and I was able to finish it with flying colors. Everybody of my classmates are quite jealous of me. Okay, so she showed me the histopathology report. So the histopathology report is a report, no, wherein the pathologist will say, no, what their findings of the sample that they got from the surgery. Okay, and in that one sentence, no, showed that there's partial response of the tumor. Okay, so this means that the tumor reduced in size, but it did not reduce in enough. The size did not shrink enough. Okay, so there was this information that it's a partial response. Okay, so this is what I mean, and because of that, no, because of that I did a lot of changes with my recommendations. Okay, so so when a patient comes to me asking for chemotherapy support, I always need the details of what chemotherapy that the oncologist is going to use. So the name of the chemotherapy and how often it's going to be given. Because I have to know when I can resume PPARS again. Okay, now here's the problem. There are a lot of chemotherapy medications that are being given quite frequently, once every 2 weeks. Sometimes you're going to be on it for 3 weeks, then rest for 1 week or 2 weeks, then start again. Another cycle of 3 weeks. No, sometimes there are chemotherapy medications wherein you'll be 2 weeks on it, then 1 week rest, then another 2 weeks on it. No, so with this, I design the protocol of the patients carefully, based on what the oncologist is giving the patient. Okay. So, paclitaxel, capecitabine, each and every one of these have different half-lives. So I would look into the half-life of a chemotherapy drug, compute at least 3 to 5 half-lives before I start or before I restart the PPARS. Okay? If the chemotherapy is being given quite frequently, so you would have few days of rest only, okay, then you have to be primed with PPARS first. So you get the biological effects already, then start before starting the chemo, so that the biological effects do not disappear, or you get enough of it, even with few days of taking it only in between of the cycles. Okay, so that's how I do it already. So for those of you who are undergoing chemo, it is a must that you go for a consult. If you want to do it quickly, okay, it's a must. Alright? Because I compute for the life of the chemotherapy.
I think this is so important. Again, how important it is, like what Dr. Jansen said, whatever we share here on the video is for educational purposes. And it's so important that you go for an actual consult if you want a proper dosage for your specific case. So as Dr. Jansen has explained, for the use of chemotherapy, Simply Nature PPARS can actually end up blunting some of the chemotherapy side, efficacies that patients may be going for. So you really have to, so for those who are going for chemotherapy support, I would strongly suggest that you have a consult with Dr. Jansen. On the positive side, I want to also highlight that, sometimes the patients will ask us if the Simply Nature what's that called, protects, how shall we say, okay, never mind. Doc Jansen has said a lot. Yeah, go for a consult with Doc Jansen if you're going to apply for chemotherapy, right? And I think this is really, really important when people ask questions over here on our program. I really want you guys to know that when you want to ask for specific dosages, don't just take what we say on this program, because what we say is for a general person in your general condition, but nobody is in a general condition. Everybody has a specific one. So go for a proper consult.
I couldn't agree more. I've seen how Dr. Jansen does his consults. He's very meticulous. He digs deeper on the medications that his patients is really taking. So there, want to go for a consult? Just simply type in how to consult. Our HES will get in touch with you individually. Excuse me. For our next question coming from Ms. Gertrude, how can PPARS help to normalize my blood sugar?
Oh, Doc, you want to take
okay. It moves fatty acids. It helps you, it makes it more efficient for you to metabolize fatty acids or fats. Yeah, so that's how. And of course, to lower inflammation as well, because inflammation can also increase insulin resistance that leads, elevation of your fasting blood sugar. So that's how basically.
So in more layman terms, because Doc just threw a lot of medical terms out there, for type 2 diabetes, you are actually insulin resistant. Okay, so what Simply Nature PPARS does, the mechanism of action, is actually it makes you insulin sensitive again. So it really basically restores your body back to the way it's supposed to metabolize sugar. And how it does that is by moving fatty acids and everything else, everything more in depth that Dr. Jansen just mentioned. Okay, but yeah, the simple thing is diabetes is insulin resistance. Simply Nature PPARS' main mechanism is to help you to become insulin sensitive again, so that your body actually works the way it's supposed to work. Yeah.
Thank you, Doc. Thank you, Doc. Thank you, Sir Shyan.
That's why we are here as a partner, right? Doc can feel comfortable to give the medical explanation, and then it's my job to make it more easy to understand.
Sometimes I forget that.
Yeah.
Well, I'm sure our viewers, regardless, are very much thankful to the both of you. All right, for our next question, okay. Coming from Ms. Naida, what food is bawal or prohibited when starting with PPAR soft gel capsule, PPARS plus tablet, and cleansing plus?
For what though? You must let us know
Yeah,
bawal for what,
It
right?
wasn't
If you are
indicated
a healthy
here.
person, nothing is okay. I mean, not nothing
Nothing
is
is
bawal, but
bawal.
you can eat everything in moderation, lang. Okay. So wait, there is nothing bawal for you to take in tandem with any of the products, because number one, we always encourage our patients and clients to take the Simply Nature products on an empty stomach. This is just for better absorption without any dilution from any of the food that you're eating. All right. Since some foods like caffeine and all that might, I guess, destroy some of the goodness of the natural PPAR products that you're taking. So that's why we generally encourage people to take it on an empty stomach. So in terms of mixing it up, you shouldn't have this problem. Now, so what is bawal for you is basically the illness that you are actually trying to recover from, right? So if you are a cancer patient, then avoid all processed food as much as possible. Avoid meats, avoid dairy. Yeah, go for plant-based protein. If you need more proteins, yeah, things like that. And for diabetics, they should actually avoid fatty foods and oils
Yes, correct.
more than sugar. Then, doc, okay, here's the funny thing, doc. There is this, so for diabetes, fats cause diabetes. Then why does keto diet, which has like lots of fat and protein, why does it cause seemingly your blood sugar level comes down?
Goes down because you're not eating carbohydrates.
Okay, there you go, everyone. That was a trick question. Actually, I know the answer. I'm just asking Doc Johnson. All right. So keto, if you go on a keto diet, unless you plan to stay on a keto diet for the rest of your life, right? You won't have blood sugar problem because you're not taking sugar. All right, you're basically not taking sugar, so you don't have blood sugar problems because carbohydrates are sugars. However, the keto diet thing, I've spoken, Doc, recently there's actually a lot of podcasts and on some very how shall we say famous podcasts like the CEO Diaries and things like that, and they are starting to talk about a carnivore diet, and they talk about how some people get negative result from carnivore diet because they're eating it wrong, they're not taking enough oils and fats, which is quite shocking to me because I don't see how you can eat meat and then don't get oils and fats. That's quite shocking. I can understand for very special cases, very unique cases where they've tried everything and then the carnivore diet works for them. But what I guess I am still skeptical about is that there seems to be a push for the carnivore diet to be a normal preferred way of eating for most people, which I think it's a bit dangerous to jump on that bandwagon yet, because I can tell everyone it is proven for centuries that those who eat vegetables live long lives and are healthy. All right. So and here's another good example, right? The strongest animal on land, the elephant, only eats vegetables. So we can't say that. So I just want everybody to be a bit careful when it comes to the carnivore diet. I'm not saying that it doesn't work. I'm saying that it probably does work. I've seen the preliminary information for very special cases, especially people with some immunodeficiencies, right? So these are very, very special cases. And even for epilepsy, keto diet is actually used, and I've talked to a few doctors who actually prescribe keto diets. As a general rule, they don't use keto diets for more than 3 months. All right, so obviously it's not something meant to be on forever lah. Okay, yeah. So There you go.
Thank you, Sir Shyan. Thank you, Doc Jansen. All right, for our next question coming from Mr. Rain Sebastian. Can PPARS help dissolve the tumor?
Yeah, it can, no, but of course not directly, and
Mm.
you have to utilize not just PPARs but also other things to help shrink the tumor. But it can help definitely. It's one of the ingredients.
It's one of the key actions, And I think at this point I would like to say something about the program. I like our discussion in the program, and I hope all the viewers also enjoy it in the sense that you can feel confident that there are a lot of questions of can people do this, can people do that, and a lot of our answers are actually no, it can't. Right? Some people will ask us, can people get rid of gallstones? The answer is no. Right? So this program is not a pro PPARS program, so I'm glad for some of the questions you asked so that it can become clear, because here, at least at Simply Nature, and I'm sure with Doc as a medical practitioner, we want our viewers, our patients, our clients to get the healing that they are looking for. So that includes providing the information as best as we can. So we will always grow and learn from experience and from new research, and also from new understanding, and also new protocols that come out every year. So as Dr. Jansen says, over the years, our approach will be fine-tuned, will be improved. All right. So yeah. Sheila?
Okay, thank you, Sir Shyan. Thank you, Dr. Jansen. For our next question, coming from Ms. Maria Rowena, whose health concern is breast cancer stage 2B. What can I do to lessen the side effects of my chemotherapy that is starting soon? So I think you may give tips on how to prepare for the upcoming session.
Okay, number one, my first advice is go have a consult with Dr. Jansen, right? Because he already shared. He will actually look at the chemo drugs that you're taking. So isn't it such a good answer to this particular viewer? Instead of someone who say, yeah, just take this, there is a doctor that says, tell me what you are taking now. Tell me what is the therapy that you're going to do. So you will want someone who asks you that question, because that means that person is really trying to understand your condition and then giving you what he or she has experienced will be the most effective combination to help you with your case. Doc, maybe you can give us some general advice, but I think for this viewer, have a consult with Dr. Jansen so that you can go through your chemotherapy looking and feeling good, all right? And that you'll finish the whole thing without any issues. Yeah, Doc.
Yeah, so for patients who are undergoing chemotherapy, the approach is not only to help reduce the side effects, but also to help improve the efficacy.
Wow, I was about to ask you that. So we can
actually the chemotherapy.
So Doc, I was about to ask you that. So we can actually do things to make the chemotherapy work better, at the same time reduce the side effects.
Yes.
Wow, isn't that what you wanted to hear?
And that's and that's important, no, because there are cancers, no, are resistant to treatment. There are a lot of them. That's why we hear a lot, cancer patients are undergoing for it. It's not working. So that's why you go, that's why you're here in the first place. Now trying to get information on what other, how can you deal with the chemotherapy, or if there are any alternatives. So yeah, that's a very important thing that we have to do. Make lessen the side effects, and number two, improve the efficacy of the chemotherapy, or at least reduce the resistance of the cancer cells to the chemo. There are a lot of molecules or supplements, medications that you can use for this. So, but the most important of all, is the immune system. Your immune system should be strong. So if you're someone who's going to undergo chemotherapy, you have to start an immune booster right now. So you have, Simply Nature PPARS is one of the immune boosters that you can be on already. Then when the time comes that your chemotherapy is, you're going to go for the infusion, just stop taking Simply Nature PPARS, allow a few days to pass by after receiving the chemo, then restart it. is how soon can you restart? How soon can you start it again? So that's why I have to see you. Okay. Yeah. So that's the main thing about this. Also, depending on how bad the side effects is, we can start the PPARS. Yeah, so that you'd be able to recover faster. Okay, so there is this nuance as well. So it's really very important that a health professional, a doctor helps you when to decide, no? So yeah, I have to see you to really help you properly. And there are also other medications, drugs that we can repurpose, supplements that can help reduce the resistance. So that's the beauty of it.
Thank you, Doc. That is actually very, very encouraging. As you know, a lot of people out there are very scared to go for chemotherapy, and here you are advising them that it is really possible to, strengthen the effect of chemotherapy for the benefit of the patient. Yes. Thank you, Doc Jansen. Right, for our next question coming from Ms. Jennifer. Right, the buccal or the tumor is already operated and sent for biopsy. The results were HER2 positive with a score of 3+ or 3 positive. Do I need to have another operation again? What if I don't and just take herbal medicine?
Operation, you've been operated already, so you don't need another operation, but you need the trastuzumab treatment. That's very important because if for HER2 positive breast cancer patients, trastuzumab is really a wonder drug. It if you're on, so HER2 positive breast cancer cells are quite aggressive. So without treatment, the prognosis is bad.
Okay.
Yeah, really, really bad. Okay. As in you can die from this, in months' time. But if you are on trastuzumab, then prognosis suddenly becomes really good.
Wow.
It's like that.
Wow.
Yeah. So from one end of the spectrum, suddenly you jump to the other end that you live well. So you have to be on it. You have to be on it. Okay.
Wow. Doc, I'm just curious, many of our viewers actually call with very similar questions. So I'm just curious, did their uncle not share with them how wonderful their protocol is? I'm just curious, how come they're asking, how come it must be you and not the uncle who's actually telling them?
Yes, it must be me because no onco will promise this.
Oh,
No onco will promise this. Yes,
why?
because because if it doesn't work, then what are you gonna say to the patient?
Okay.
But if it's me who tells the patient to go back to the onco to undergo treatment, then I mean,
Okay, so the uncle
it's okay.
is okay. So maybe it's really like a wow. I don't know how to explain this.
Well, because there's no conflict of interest when I'm the
Okay,
one who's
okay.
saying it.
All
Yeah,
right.
so I think it's but that's my experience. So that's why I really encourage, so far my patients, so my patients who are going for conventional treatment only, doing a mix of conventional and integrative medicine, and those who are only focused on integrative medicine, those who have the best outcome, or the best outcome are those who mix both worlds. Yeah, so I have to be honest with this. And for those of you who are just focused on one school of medicine, so conventional onco or integrative onco, then that's the time you see gaps. That's the time you see gaps, no? So for for patients who are undergoing conventional treatment, sometimes you see failure of treatment because of the oncologists are missing integrative oncology principles. Okay, so and medical oncologists recognize this. They do recognize this.
Oh
No?
wow, do they? Okay.
Yeah, they do. Yeah, they do.
Maybe that's why there's new fields like medical nutrition. I think they're trying to plug the gap, in different ways. Yeah.
Yeah, in different ways. And that's why orthomolecular medicine, integrative medicine exists because of this, no? And and that's why, patients are also here listening in our, webinar. So, because they recognize these gaps. So on the other hand, with just alternative medicine, you hear horror stories. You will hear horror stories. So one
Wow.
patient only did herbal, or one patient did only whatever treatment, uh, or some detox regimen or whatever. Then they still die. I mean, just look at documentaries in Netflix. You'll be able to search for a lot of documentaries about these scams. No, there are a lot, right? So really have to mix both worlds, and you have to have someone, the right
Who knows
expert to
both?
help you.
Yeah, who knows both worlds. Doc, I'm gonna make a generalization so that our viewers can, I guess, more easily understand the advantages. Or I know it's not gonna be accurate, but tell me if it's acceptable, right? I would say that conventional medicine has the most powerful destructive weapons to fight cancer. And then the integrative medicine has the best ways to strengthen and nourish the body to fight cancer. If I would, yeah, right. So this is where the gap is. The person with the most powerful weapon may not be very good at preserving and strengthening the body, right? And the person that strengthens the body, right, may be lacking the most powerful destructive weapon. So, you want to have a sword and you also want to have a shield. Can you kill someone with a shield? Yes, if you hit the person hard enough, you will also kill someone with a shield, right? But a shield and sword combination is best used together. So as what Dr. Jansen says, right? So in our program, I know, you know, Doc Jansen says that he's fine-tuned his practice. Over the years, I've also been more convinced. When I first met Doc Jansen, wow, how many years ago was that now? Maybe 6. I have no idea. It's been a long
2018,
time.
since
Yeah.
2018.
2018. Oh my
Oh my
goodness.
God, it's
2018,
7
7
years.
years.
Oh yeah. Wow, Doc. Okay, we both aged, but I think we aged pretty well. Okay. 7 years ago when I met Doc Jansen, really I was very pro integrative. That means try to avoid oncological protocols if you can. All right. I wasn't against it, but I was definitely more pro that. Over the years, right, I begin to, especially when I meet cancer patients. So the first one that really changed my life around is actually Ms. Sheila's son. All right. Because without going for chemotherapy, her son would die like imminently. Right. So what we did was chemotherapy together with Simply Nature PPARS liquid. And today Dominic is actually second in his school, right? Or top in his class, something like that. And he's in full remission. So that's the good news. So over the years, and like what Dr. Johnson said today, right? The onco cannot say this. And doc, it's really true, when a patient meets an onco, it can be very discouraging. The doctors always speak to patients like, yeah, things don't look good. You only have 40% chance of surviving, yeah, and then they don't smile, they don't they don't say anything encouraging. So I can imagine how a patient would leave the room quite disheartened, and say in their mind, I'm not going to take all these chemo drugs, because even the onco doesn't sound very confident about that. But and then maybe a lot of people don't want to ask their onco questions because they are not necessarily the most friendly people. Because okay, don't be angry with them. They're very stressed and things like that. All right, and it's what they have been taught to in med school, to not get too emotionally attached as well, because they meet so many patients every day. Okay. So next is, so like what Dr. Johnson said, like HER2 positive is aggressive cancer. So it's really wonderful to learn that there is a drug that changes a very difficult, aggressive cancer into one that is very manageable. I think that's how can you ignore that? If you have a HER2 positive, this is something that even any doctor will recognize. This is a very aggressive cancer, right? So number one is real, its danger is real. And here is a drug that works very well for a lot of people, right? And why would you not want to use it and then just focus on managing the side effects of the drug? So at least you have a good weapon that you know will work against your cancer, give you a really good fighting chance to do well and survive. Then with so you sort of like can rest your mind that says, okay, my cancer fight is going to be okay. So now I only need to focus not to fight cancer, but just to improve and minimize any side effects because the drug's going to work. Right? I think why not have a proper look at the approaches this way? So again, there are always patients who have reasons that they want to go natural, but if you can, I would say use both. And now I changed my mind also. In the past, I would say that if I'm diagnosed with stage 1 or early stage 2 cancer, I will try natural for a month first, see how things work. And if things don't improve, then I will go for combination, right? Now, after hearing you, I will really go and check for this particular cancer. What is the success rate of the chemotherapy drugs, right? If it's good, you know what? I'm not going to wait 1 month. I'm going to do it and then drink lots of liquid, timed properly to help me recover. Because why would you not want to use the most powerful destructive weapon that can kill the cancer and at the same time get the best shield that you can get to protect from any of the side effects? I think that should be the best approach. Again, it will differ from cancer to cancer. For prostate cancer, which is very slow growing cancer, that if you are diagnosed stage 1 prostate cancer, I think the standard protocol is do nothing but to observe. Then I would say go and take the liquid, all natural, go and try and cure your stage 1 prostate cancer totally naturally, right? Because even the onco would say, let's just observe it. So you see, in different, cancer is such a big word. There are so many different circumstances. So your knowledge about your type of cancer that you're undergoing is so helpful for you to choose the right strategy for you. But in general, I will agree with Dr. Jansen, do a combination, the best of both worlds, right? And choose the right doctor who knows both worlds, right? So yeah, I'm not that I'm purposely trying to plug Dr. Jansen, but he is, like I said, we've been together for 7 years. So Dr. Jansen has 7 years of experience using Simply Nature PPARS with different type of patients undergoing many different treatments from immunotherapy to chemotherapy, radiation therapy. And so this rich experience makes him very an expert in this area of integrative oncology, especially using our Simply Nature PPAR protocols together with oncological protocols. So, yeah, Sheila.
Thank you, sir. Very, very quickly, I just want to share that, what Dr. Jansen is doing to the patients, most especially because this question is very much relatable, most especially to those who are just newly diagnosed. They are scared to go further. And what Dr. Jansen is doing is he is empowering his patients so that when they go back to their oncologist, they have this more confidence to proceed with the treatment. And this is what patients need, to understand more what they are really going through and what they are going through in their treatments. And if you remember, Sir Shyan and Dr. Jansen, you always say this: ask the right questions. And this is what the lady just did today. She asked the right questions.
I hope we answered you and gave you confidence that you're going to do well in your fight against cancer, and that the treatment that your uncle has introduced to you, Dr. Jansen, I hope he has given you the confidence that it is a very effective treatment. Now, to be more specific to your case, please have a consult with Dr. Jansen so that you can go through your treatment best, and get the best results.
Definitely. All right. Thank you, Sir Shyan. Thank you, Dr. Jansen. Let's try to answer 2 more questions before we part ways. Okay, for our second to the last question coming from Ms. Marge Ko, can a headache be considered as a healing crisis from taking PPARS powder?
Okay, this one I can answer because it can be, but it shouldn't persist. All right. Yes, it can be, but the whole idea between a Herxheimer reaction or healing crisis is that your body sort of, for layman understanding, your body is going back down the same journey it built up. So for example, for example, you will always have fever first and then a headache. And then after a while, you don't get fevers anymore. You only get headaches, right? So you take PPARS and then suddenly you are getting fever again. So it's actually like a reverse journey. Your body is actually healing. So its sensitivities come out. Okay, I'll give you another very simple analogy. It may not be very accurate, but I hope it just helps you understand. If you are a smoker, if you smoke, you don't cough, right? You don't cough. Okay, why? Because your lungs are used to smoke. If you stop smoking for 2 months and then you pick up your first cigarette, you might be coughing. So after 2 months of not smoking, should your lungs be healthier or worse? They should be healthier. Then how come when you pick up your cigarette and smoke when you have healthier lungs, you cough? And when you don't have healthy lungs, you don't cough. Okay, it's really because your body systems are actually recovering and they're actually reacting. They're actually working again. So one of the common symptoms is actually things like fever, headache. Okay, but the important thing is that it shouldn't persist. Right? It should only last maximum 3-4 days. Okay, and it shouldn't get too severe. If it gets too severe, then go and see a doctor. Okay, and anytime if you're not comfortable, if you're worried, go and see a doctor. So Dr. Jansen is a great doctor to see because he's actually very familiar. He prescribes PPAR protocols to so many patients in different types of illnesses and conditions, right? So there you go. So yeah, doc, I mean, from a medical point of view and integrative point of view, it's not only simply nature PPARS. Even when you fast and things like that, like detoxing process, headache is often a most common symptom. Do you know why that's the case?
Okay. Why do you develop headaches? So, it's actually a Herxheimer reaction because PPARS, no, the main ingredient of PPARS is Chlorella sorokiniana. So it's a family of it's within the family of Chlorella, and Chlorella
Yes.
is it's a very good detoxifier. So when we detox, there are toxins that move from our fatty tissues into the blood. That's when you experience, have a reaction, of course. So it moves from different compartments, no, the toxins. So usually, because of our environment, we store toxins. So where does it get stored? In fatty tissues. Fat, no? Your brain is a fatty tissue. Okay?
Okay.
Yeah, it's a fatty tissue. All right. So yeah, and literally fat as well, no? So when you that's where it gets stored. Okay, so normally you don't feel anything because the toxins is not present in your blood. It's stored in your fat. Now, when you begin taking any detoxifier, so may it be algae, may it be chelation or whatever tea that you have there. So when you begin detoxifying, the amount of toxins present in your blood will go down. When it goes down, the organs that store them will begin releasing these toxins slowly. So when they release it, your blood will now have an increase in the toxins. So when the toxins increase, that's when you develop the symptoms, the Herxheimer reactions. So what you have to do is continue on taking the one that the detoxifier, because eventually that symptom will go away.
Yeah.
Eventually that symptom will go away. Okay, so you have to continuously use it. So what do you do if you do develop headaches? Take pain relievers. That's what you do.
Yeah, help you, or, or the Chinese will say just bear with it. Soldier through it. Okay, so again, this don't do this. I'm just sharing with you as an experience. Please don't do this. Okay, maybe I shouldn't share, right? Say don't do this so much. But this is to go back. There was a hyperthyroid patient, a friend of mine. So when she takes Simply Nature, when she took PPAR powder extract, she actually had high fever and was almost, how should we say, bedridden for 2 days. Okay. So she was under the care of my mentor, who was at that time my mentor was an integrative doctor, right, in Singapore many years ago. And she was confident enough he prepared her mentally what she was going to go through. So yeah, she actually endured through, I think, 4 days of high fever, headache, and basically couldn't move much out of bed. So she's a hyperthyroid patient. All right. So the good news is that she was able to, after that, her hyperthyroidism did not completely go away, all right, but it normalized to a great deal that she was able to cut a lot of her drugs. So you'll be surprised, right? A person with hyperthyroid is supposed to be thin, but she's actually fat because she has to take a lot of drugs to make her hypothyroid, right? To slow down her, to calm down her thyroid. So, but once she was off the drugs, she went back to a normal, healthy weight, right? She kept the drugs at hand, but through that whole process, she was able to bring it back. She still was on drugs, but very minimally. Okay, so this is just a good example of why. Okay, she had an integrative doctor, my mentor, at on call, watching her. So that's why I always say when I hear her process, I always encourage all thyroid patients who want to go on our protocol to have a doctor with them because they might have more serious Alzheimer reactions. So I always encourage them to have a consult with Dr. Jansen, right? So Doc, thank you. So now I understand why we have fever and why we have headache, because the toxins are being released in our body. It makes sense that you will feel headache and that you will feel feverish as well. Okay, that makes absolute sense. Yeah.
All right. So, let's try to answer the
One
next
last
question. One last question. Okay. So coming from Ms. Jeanette Montanes. Good evening. I just want to ask, can PPARS dissolve gallstones?
No.
No.
No, no. No.
No. Okay. The way you dissolve, guys, I think this question was also asked last week. So gallstone is to produce more bile, okay, and to reduce the cholesterols because gallstone, the most common gallstone, is a cholesterol stone. So very similar to your powdered juice drink, and you put in too much powdered juice drink with so few
Little liquid.
water that it comes up. Okay, so the solute is I'm being too scientific here. Anyway, so you get the idea. So it's the same way in your gallbladder. Your gallbladder is a stage of bile, no? So your liver produces bile. Bile is like milk. So if you have too much of the powdered juice drink, also known as your cholesterol, too few of the water, also known as your bile, then you will have stones or clump up powder juice drink. Okay, so that's the mechanism. So what you have to do, how do you increase bile production? By taking ursodeoxycholic acid. You can also take ox bile. You can also drink teas which encourage bile production. There are such teas. And of course, reduce cholesterol. So you have to, avoid animal food products. You have to, basically reduce cholesterol. Yeah, so that's how.
Doc, for integrative, holistic, naturopathic, they actually use what? Epsom salt. Are you familiar with that?
Yes, Epsom. Yes. They use Epsom salt, olive oil. These two. Yeah, but
So,
I won't. I won't recommend it. I won't recommend it to anybody because number one, I'm not a naturopathic doctor, and
That's
number
right.
two, because of the anatomy.
Oh,
There is a risk that the stone will get lodged into a sphincter found in your duodenum, and if it gets lodged there, then you can develop pancreatitis, and that stone has to be taken out surgically, or else you can die. Okay, so that's the danger behind it. So
Okay.
that's why I'm not recommending it. I'm too afraid to recommend it to anybody.
All right. So you see, it's like that, right? Okay, you hear Dr. Jansen answer like that. Okay, I'm going to take the opportunity. This is why your uncle, right, will also say, don't take any supplements. All right, because you can see Dr. Jansen, his first statement is, I'm not a naturopath. So he is not, this is not his area of expert, so he's not going to recommend it. Yeah, because this is not his area of expertise. So many times your uncles will tell you don't take any supplements because why? They are afraid. Why? Because it's true. It's true. Aren't there many crazy supplements out there in the market that will do you harm instead of helping you? So your uncle is definitely going to be very afraid that you take one of those things, right? So it's not his area. Yeah. Okay, another one which I'm sure Dr. Jansen will not recommend, and neither will I, but I'll just tell you anyway, just since you asked, there are many options. Another proven way is in the TCM, they have something like this also. They don't take Epsom salt. They take something else. What is it? I do not know, doc. Okay. Then after that, you drink a whole cup of olive oil. And then you pass out. You pass out the gallstones. So how do I know it works? Because my wife actually did that, and that's how she passed out her gallstones many, many years, like 20 years ago. So that's when I found out, oh, wow. So then when I found the naturopathic have the Epsom salt, but also olive oil, I suspect the mechanisms are very similar, but probably using different substance to trigger the same thing. Yeah. Okay, but Dr. Johnson gave you another alternative, right? So yeah, choose. Do your own research and choose. And then as Dr. Johnson said, as you do your research, you will probably see that one Doc, the process that you suggest, how long does it take to flush out the gallstone or dissolve the gallstone?
Okay. If you use the medication, they claim that you can dissolve the gallstone in 6 months to a year time. It's too long. Yeah, so this is what they say. Now, if you style,
Right.
Little choppy.
Yeah.
Doc, you're very choppy. We didn't get the time frame. So how long does it take
Just
to
how
flush out the
long?
gallstone?
Okay. So if you just use the medication, they claim that it can be dissolved in a
Yeah.
span of 6 months to 12 months. 6 months to 12 months. Okay.
Okay.
Yeah. But if you mix in lifestyle, more conservative estimate would be 6 months. Yeah.
Okay, Doc, now I know why some people will choose the TCM because it'll just take 24 hours. Yeah. So of course, then I guess what Doc Johnson says is the anatomy risk lah, right? So if you're ever going to do anything like that, please choose someone who actually knows what they're doing, okay? So that's all I want. Please don't just hear some person, your neighbor tell you, okay, because there might be finer details, right? Not every TCM will actually recommend this to you because maybe there are more details, your condition, and things like that, that doesn't, you shouldn't use this method, okay? So yeah, why don't you go for the slower but safer method? All right, and only if it doesn't work, then maybe consider something else. But this is, again, like I said, this is very interesting. And one thing you will know that many medical practitioners is like when we study it in detail and then when we understand, then we say, okay, now I know why it will work. You know, it was the same doc for acupuncture. Many doctors think it's nonsense. How can you poke someone in the hand and then they get well? Until they study acupuncture and then they try and then it works. Doc, this afternoon, just a slight chismis. This afternoon, I was talking to my acupuncturist, my TCM doctor, and we were just talking acupuncturist because my friend sends his dog for acupuncture.
Wow.
And then my TCM who also knows acupuncture told me, yeah. Then I asked her, how did they figure out the points for a dog, you know, and for animals? But it's interesting. All right, just to let you know, guys, in Singapore, they do acupuncture for dogs. And it works. It works for my friend's pet, right? So you can't argue with results. You can only say, I don't understand, but it works. Okay.
Thank you, sir. Thank you, Dr. Jansen. Well, I'm afraid that's all the time we've got today. But don't worry, for those questions that we weren't able to answer today, we'll have it answered privately or ask them next week on our next week's webinar. So we're almost at the end of the webinar. Sir Shyan and Dr. Jansen, I hope that you can still answer very, very swiftly how many tablets or should 0 to 12-year-old kid take while you are saying your parting words also. So as we wrap up, for 0 to 12 kid, 0 to 12-year-old kid with no health issue at all.
Oh, okay. I can share that.
All right. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers. Dr. Jansen?
Yeah, I go first, no. So, everybody, just want to let you know that I'm going to the International Conference of the Orthomolecular Medicine Society.
Oh,
Okay?
wow,
So
really?
it's going to be next week. So
In the US
yeah,
or in the
no,
US,
in Tokyo.
Canada?
It's in Tokyo. International Society for Orthomolecular Medicine. So there are a lot of things that they're going to discuss there, and I'll let you know when I come back. So next week I won't be
Wow.
available
We'll miss
for
you,
the
Wow.
webinar. So now,
Doctor, I'm
yeah,
very interested. So I'm gonna be in town in October 4th, 5th, 6th, 7th, I think. I would love to catch up with you. Maybe I'll arrange for a meeting with Dr. Jaime. He's actually one of the I think he's the second ophthalmolecular practitioner in Philippines, and he's the one that actually met Paulus Lining. Paulus,
I met him.
yeah,
Yes, yes.
yeah.
I actually was able to talk to him personally already.
Oh, wow.
Yeah, we were able to connect back in another conference. Yeah,
Yeah.
in another conference as well.
And
So he knows me. I know him.
Yeah.
Personally.
And you know what?
Yeah.
He's a doctor, but not a medical doctor. But he really knows his stuff
Yeah,
because he's a doctor of biochemistry.
Biochemistry. So wow, really amazing.
Yeah,
So
really, really amazing.
yeah, and we went to the same alma mater in high school.
Wow. Okay.
Oh,
So
really?
I tell you what, when I'm in town in October, I'll arrange. We have a dinner with Doc Jaime. And there's so much that we can talk about. I would love to hear him talk about orthomolecular because he's so into it, and his biomed background puts him. He's even more qualified than most doctors. Or I would say he's more qualified than all doctors when it comes to orthomolecular because his grasp of biochemistry is so important in this particular approach. It is so important. Yeah, all right, okay. All right, thank you very much, Doc.
Well, yeah.
We'll miss
So
you,
I'll
though.
give the floor to Sir
Yeah,
Shen.
we'll miss you next week. Okay, my parting words, I'll start off by answering the last question is for kids who are very no illnesses, how many should they take? Then I'll give you a very simple guideline, right? Take a number of tablets equals to their age. So if you're 3-year-old, take 3 tablets, 4 years old, take 4 tablets. Is this a very accurate way to do dosaging? No. Does it matter? Actually, no also, right? Because your kid is healthy, you're taking it to make him smart. Okay, I would say this. Most parents want their kids to grow up smarter, stronger, healthier, right? So it's not just healthier. You want your kid to be stronger. You also want them to be smarter. So this is from my personal experience. I have 2 nieces and nephew. One took my product religiously and the other didn't. Okay, I can tell you which one did very well in school. Okay, and now the reason is always because my nephew Brian took it because he had some constipation problems, right? So the tablets actually help him move his bowels. And not only that, after that, he realized it kept him alert. It rounded off his nutrition, right? It rounded off his nutrition. So many infant formulas have this thing called DHA, which is supposed to make your kids smarter, right? Actually, that is actually found in Simply Nature PPARS tablets, right? Not the extracts. Right? Then of course CGF, growth factor is all that. So it's a great supplement for kids. Right? It's really great supplement for kids. Can they eat too much? The answer is no. They cannot eat too much. So the general manager of our factory in Taiwan, his son likes to eat it like candy. He can finish an entire bottle in like 2-3 days. Okay, no adverse effect. How do we know this? We've actually done a test called a LD50 test. It's a lethal dosage 50 test. So there is there's no lethal dosage, no long-term build-up of toxicity. Okay, so simple guideline for your kids, based on their age. If they are 5 years old, 5 tablets, right? So as they reach 12 years old, they basically end up taking the same as a adult already. So what are the effects that you will see? Okay, another one of it is my personal mentor. He has 2 kids, 2 daughters. This is what he tells everybody around us. His daughters have been eating Simply Nature PPARS since they were like 6, 7 years old. They practically have never gotten sick, all right? Over the last, and now, okay, again, this is because his daughters are smart, right? But I'm just going to share with you, it's the truth, right? It's just the truth. The 2 daughters went to Canada, right? For high school. The eldest went there first. She went there when she was only 14. So she's like 14 or 15. So she's actually 1 or 2 years younger than every Canadian there. She topped the school and she became the school president and topped the school in all her subjects every single year. Then her sister came. Her sister topped her level as well. And the teacher said they've never had 2 sisters top their each level at the same time. Now, the eldest daughter actually graduated. She got accepted into Yale University, one of the top universities in the world, and she rejected Yale and went to England, to Bristol University instead. And she's now a lawyer. Before she's even finished, she's still studying. Before she's even finished, HSBC has already hired her and wants to send her to Oxford, Cambridge for her master's in law. So, okay, I'm not saying that Simply Nature PPARS makes her smart. I'm just saying that these 2 smart kids took Simply Nature PPARS tablets throughout their entire growing years. They take it so faithfully, and they are a wonderful testimony of it. Of course, they're also 2 of the most disciplined kids. Oh, sorry. Entire growing years.
Oh, no, I don't know where.
Yeah,
Okay.
okay.
All right.
Again, they're the most disciplined 2 kids that I've known, but there you go. So for all parents, yes, this is one of the tablets are the best supplements for your kids. No, you don't have to take the soft gel or anything more. The tablets are enough and they're really the best. Okay, so with that, I'll see you guys next week. We want to talk Jansen, but please come and support me as well. I will. I may not answer all the technical medical questions specific to, for example, your case of cancer. But what I can answer is definitely all your questions about Simply Nature PPAR protocols and how that works. Okay, yeah. So thank you. I hand the time back to Sheila.
Thank you, Sir Shyan. Okay, so once again, thank you so much, Dr. Jansen and Sir Shyan Lim, for putting so much effort and care towards all of us tonight in answering your questions. Now, for everyone, thank you for your questions, and thank you, of course, for considering our program as program of value while we journey with your own health battles. So, on behalf of our patients, once again, thank you to our health experts. Now, if you are a loved one is battling any type of cancer, any health issue at all, remember, science is evolving and new treatments are emerging all the time. Keep informed and explore all available options. So don't forget to like our Facebook page, Simply Nature International, and Simply Healed Medical Group and Dr. Jansen's Galalan's Facebook page. And subscribe to our YouTube channel. This is also to make sure that you get updated with our latest promos and events. Now, today is the last day of the 9/9 mega sale in Lazada. So hurry and avail our Simply Nature PPARS at an unbeatable price. Another exciting event next week in our next week's episode, of course, is Simply Healed webinar happening on September 18, Thursday. That is once again, same day, same time at 7:30 p.m. So once again, thank you for spending your time with us today. This is Simply Healed webinar powered by Simply Healed Medical Group and Simply Nature International, because your curiosity about your health condition and your victories over cancer and metabolic illnesses are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.